Shoulder pain during training isn't random, and it's almost never caused by the exercise that you're doing.
Stop the cycle of pain. This test isn't going to only show you where you're restricted. It's going to actually show you where your shoulder is functional. And based on your score, I'm going to show you what's missing and how to create that function for the long haul.
In the last video where we did the overhead squat assessment, it exposed full body movement issues. If your bar dumped forward, if your ribs flared, or your shoulders collapsed under the stick, that wasn't a squat problem. It was a shoulder control problem.
So today, we zoom in. If your shoulder hurts during bench, overhead press, rows, bicep curls, this one test is going to tell you why.
So this is the shoulder reach test. It reviews scapular mobility, thoracic rotation, and how well your shoulder blades sit on your rib cage. You're looking to make that fist with your hands. Reach one hand over the top. You're going to reach one hand down to the low back. And the goal is to touch your fists together. You're scoring the distance between your fists, not how it feels. And here's how you score. We're going to look at our zeros and ones first.
Now, if you scored a 0 or a 1, like me, that doesn't mean you're broken. It means you're compensating, though. You can keep lifting, but we need to fix the problem.
Step one of the correctives is always going to be to release pec minor. We're trying to release that front tension, and then we're going to immediately train upward rotation after that. That combo is going to improve the test instantly. Obviously, you're getting a nice little taste here of some basic exercises we can focus on, making sure that shoulder blade is wrapping around the rib cage and elevating that upward rotation. Obviously, we want to work some thoracic rotation as well here to reduce those limitations.
All right, and then as we get into scores 2 and 3, more maintenance, more training functionally. So now we're not really having any issues, but we still want to build that strength.
Now, if you scored a 2, you're close, but one side's doing more work. Use these simple drills 2 to 3 times a week to even things out. We're looking at some simple snow angels. Make sure that low back stays nice and tight to the ground. We don't want that to pop off. We want to make sure our rib cage is nice and neutral. We also have our band external rotation here at the side. Slightly easier, so this is a great one to start with. We can progress that into our 90-90 banded external rotation, put that shoulder up a little bit higher and focus on that isolation a little bit more. We'll also have both options here for banded internal rotation, as we know we're going to need that for that mobility as well at the side, and then also at that 90-90 position to make sure, again, that we're training it with that shoulder up in abduction. We'll finish with those banded face pulls. Big one here is make sure that neck stays nice and neutral, as well as no rib cage flare. And on to those people with the best shoulders in the business. You scored that clean 3, your shoulders move well. Now we want to keep it moving well. We want to train it in a little bit more of an aggressive capacity. We'll have some high-low carries here to make sure we're focused. The high racked carry here just puts that shoulder in a little bit more upward rotation on that left arm in the video. That's going to help kind of maintain that shoulder stability. Then we'll go into our kettlebell dumbbell windmill. One or the other, doesn't matter which one you're using there. But again, nice stability overhead. Walks us into that Turkish get up as that last exercise here. Lots of stability, lots of good movement through that rib cage. Key here is if you can't do the Turkish get up, we can do Turkish sit-ups, half get ups to kind of progress to this as well.
You know we love a good test and retest. So come back in a week, retest the shoulder reach. If the pain goes away or the score goes up, it wasn't your shoulder, it was the pattern behind it. Fix the pattern and the pain goes away. But this is just one piece. Next, we're going to look at the rib cage, and that ties everything together. And that is why we never settle with yesterday. We're going to keep building out this mobility, longevity piece. We lay that foundation to keep building the program, strength, power, everything is coming. Stay tuned, subscribe. Appreciate you sticking around.